So we're going to talk a lot about the themes within Spin Doctors, but it is so interesting to think about where we've been and where we are today. This is a moment where history is being systemically erased as we continue to march forward in this pandemic. And it's erased in different ways. You know, we're always experiencing a new wave, new variants, new things that politicians want us to pay attention to. And we very quickly forget that, you know, oh, this is, you know, wave 6 or wave 5, or, oh, no, we've had these measures before, or maybe we've never even lost some of these measures. But the to be able to write a book about the pandemic during the pandemic was so it was so fertile. Like there was so much to jam into this book, and anybody that's read it knows that it's kind of like, okay, Nora, like enough with the footnotes, like please relax, right? But I did this because I knew that there would be a process of forgetting, and the process of forgetting allows power to be left off the hook for making very big errors, mistakes, intentional errors, and that we were experiencing this historic moment with very little common memory of the last pandemic that we lived through. And I grew up knowing that had my great-grandfather's first wife not died from the Spanish flu, I would not be here on the planet. And so I always had the Spanish flu in my mind as this very important moment that completely destroyed parts of my family and then made it possible for me to be born, because my great-grandmother was then, you know, brought over from Italy to marry my great-grandfather. But the idea that we had no common memory of the Spanish flu and how Canadians lived through it and what that looked like, and masks and debates about masks and debates about whatever, right, of how healthcare looks and who's supposed to care for who. This was what I said, you know, we live in the information age, but if we're not writing down what is happening right now, we're going to lose it. We're going to lose this moment, especially because not only is there intentional forgetting, but we don't want to remember this because this sucks. Because everything about the last 2 years has been missed events, missed family members, missed friends, people who've died, missed funerals, weddings that have been put on hold, relationships that have buckled under the pressure of the pandemic, children struggling to get through, closed businesses, economic impacts, all while the status quo was maintained above all else, all while profits were protected, all while people demanded the police be defunded, and instead of being defunded, they were superfunded, they were receiving more money. And while we were witnessing a hospital system at the breaking point in the best of times be completely under strain in the worst of times. So I don't want to take up too much time in the introduction because I think we're going to have a really wonderful conversation tonight. But I hope that as people are reading this book, I hope that you're frustrated by it. I think that that's probably very, like, the first thing that I hear from people is that they're frustrated by it. But I also hope that you're moved to action, because this past 2 years has also been a moment where nothing that has been hidden from the population, can we agree, or can we pretend that we didn't know it was this way? We can't pretend any longer that the healthcare system is being absolutely decimated. We can't pretend that ableism doesn't exist, obviously. We can't pretend that systemic racism doesn't intersect with health policy, with education policy, with economic policy. And we can't pretend that ongoing colonization within Canada means that Indigenous people are overrepresented in the statistics of who gets COVID. Reserves still have double the amount of COVID that average Canadian, the average Canadian off reserve has. And that the pandemic, as I say in the beginning on the first page or the first part, you know, the pandemic, as quoted by us from Sartre, it exploded existing social inequalities, existing social problems, right? It exacerbated those things, and it blew it wide open so that these things become undeniable. And so rather than being crushed by the feeling of hopelessness, we need to move to action, because that's what this moment requires, is action.
Okay. That was a quick half hour. It just flew by.
Half an hour. Wow.
That's what I was prepared for. Well, it's
half an hour. Oh, I'm sorry, because I can keep going if you'd like. I'm very happy to, but
it's up to you. I mean, it's interesting. I was going to ask about your choice to go with Sartre at the beginning of the book, because I thought That's from the 1300s. Why did it resonate for you and for him? You know, so many years. Well, for him, I don't know specifically when he said that, but still to reach back in time,
Yeah.
and bring it forward. I'm wondering why you decided to keep bringing it forward to now.
Yeah. When I first saw that quote, and a lot of people were talking about La Peste, the book that he wrote about a town living through a pandemic. And so there was a lot of attention on this book at the beginning of the pandemic as like, oh my goodness, like, you know, people have gone through this. And this is part of normal human existence. Like, we forget how lucky we are, how advanced medical technology has become, and how advanced like medicine has become, that this is such a normal thing to experience. But when we were looking in March 2020, when the message was we have to plank the curve, I quote a journalist from the Toronto Star, Jennifer Yang, who looked at the data. And the data shows that when we planked the curve in March 2020, it only planked for the whitest and the wealthiest people in the city of Toronto. And that's replicated all across Canada. That's not a city of Toronto thing. That's, you know, Ottawa had several instances of data that was demonstrating just how much more impacted racialized communities were here, and poor communities. I mean, the two are obviously connected, but also when you disaggregate the data, poor communities and racialized communities still did worse with COVID. And so the quote for me was this like reminder that this is not an individualized problem. This is not a problem of me, Nora Loreto, personally trying to not get COVID. This is a problem of the entire community in which I live, my neighbors' jobs, my neighbors' children, my neighbors' illnesses, my neighbors' abilities and their access to services, and every cut in the social fabric, every attack on social solidarity would mean that this pandemic would be worse. It would always be worse because we don't have the social solidarity that we need to have. And, you know, as someone who's I'm sure on the call, there's tons of folks who've been activists for many, many years, you know, things have gotten really bad. And I go back to this in the book because I think it's really the starting point for everything, like a modern everything. I don't think it's like that monumental, but the 1995 Martin Chrétien budget is the moment that Canada powerfully defunds its social security. It takes $80 billion out of social services and out of the public service. And the impact of that, of course, it takes years for the impact of that to actually make its way through all the provinces. But what did we see? We see tuition fees skyrocket. We see user fees introduced. We see public-private partnerships become the primary mode of creating new infrastructure. And, you know, there's activists who've been screaming, I'm among them, like, we need to change. It's all going to come to a head. This is so bad. No. And then it all comes to a head in a moment of this pandemic. And the difficulty is that because we don't have common experience with pandemics, I mean, we know stories of pandemics, and certainly pandemics are built into the foundation of Canada, of course. But how then do you live through a pandemic? What does that even mean? Without this knowledge, what happens in the beginning, the earliest days, it becomes a foreign thing. It becomes a Chinese problem. And journalists are far too quick to pay attention to it in that way. I quote a press conference from Bonnie Henry, who's the chief medical officer of health in BC. And she's talking about, you know, China being very careful, travel from China. And then at the bottom of the article, it's like, oh, and the new cases today come from Montreal and Washington and, oh, community spread, right? No cases are coming from China. And this is replicated over and over and over in the press. And which of course sets up the way that racism is manifest throughout this entire pandemic, from how it touches communities specifically to how we talked about this virus, the threat from afar, the obsession with talking about Wuhan and the market there. It set us on a course that was going to be very difficult to get off, and I don't think we ever did get off that course. And we also never interrogated it enough. You know, a Korean postdoc was stabbed in Montreal in March 2020, and his family, and he had only been in Canada for a couple of weeks, and he was like, out of here, this place sucks, and his family left, right? I don't even know if that's common knowledge for people, right? It made news in Montreal, but I don't know if it made news outside of Montreal. So there were consequences to the way that this unfolded. And of course, in a country that's based built on genocide and deeply ingrained with white supremacy, that those social conditions would just become completely exacerbated by the virus.
There we go. Okay. You know, something that just kept coming up throughout the book, and you've talked about it much already, is just, I guess, the tension between the individual and the collective, and journalists' ability to see the forest for the trees. And we learned a lot about a particular tree, or a leaf almost on a tree, but it wasn't allowed to be connected to that larger forest. And similarly, you know, you're talking about how this, in a sense, could be argued it was 25 years in the making, dating back to 1995, when Jean Chrétien and Paul Martin, their infamous austerity budgets. Sometimes I think this is a disease of neoliberalism or of austerity,
yes,
as much as anything else. But, you know, just like journalists, I think, can be challenged to connect the social to the individual, they're also ahistorical. And they're, you know, I mean, so for some reasons, just trying to make today's deadline. But to say, hey, have you talked about 1995? They'd be like, what does that matter?
Yeah.
So how does one get at that?
It's really, really wild because, like, I mean, and then you ask, you know, can you even at least talk about the last 2 years? Like, there was this analysis that came out from CBC this week, yesterday, about Trudeau knowing that social inequality and wealth inequality creates conditions of violence and creates conditions of social unrest, right, in relation to the convoy. And the journalist writing this doesn't even mention the last 2 years in this analysis, doesn't even mention the fact that the CERB wasn't available for the poorest people, that people receiving disability support in most parts of this country had their benefits clawed back, had no money given to them for extra PPE or for extra PSWs because PSWs were getting sick and you needed more help. Like, just, you know, the tunnel vision that journalism has in this country right now is such a huge part of this story. And partly it's a part of the story because of media concentration. And, you know, as independent podcasters know very, very well, there's an appetite out there for people to hear alternatives to the mainstream media. But it's not just that they want to hear alternatives to the mainstream media, because I don't think that, like, there's a reason why we didn't have these kinds of narratives 30 years ago or even 20 years ago. That reason is because we had better media coverage. We had far more journalists. We had authenticity in the news. We had people who you can relate to and who seem normal and who didn't seem like their best friends were also like the politicians they're covering, and they're in this little Ottawa bubble that you're like, oh, okay, wow, you all hang out together, don't you? Like, okay, that, I mean, you can feel that. You can feel that there's a lack of authenticity. And then, of course, you have media concentration. You have Canada's largest daily national media chain owned by hedge funds, like, that are politically motivated for Republicans in the States. The combination just so destroys any ability for us to have analysis. Analysis has been the first thing that has died in this new kind of media sphere. And what's filling the place of analysis are lobbyists, PR people, and academics. And it's like, there's nothing wrong, certainly, with any of those groups of people intervening, writing, participating in media, but they are the ones doing the analysis, and it's not journalists. And so as a journalist who does analysis, I can't believe I even have any hair anymore, because I'm tearing my hair out all the time being like, are you kidding me? Like, this isn't analysis. There is no historical background on this. This is not covering the experiences that people have right now. This is not talking about structural issues. This is purely individualized, or it's pushing some sort of partisan line, because it's the only way that we're allowed to think in this country right now is through partisan lines, if we're doing, you know, serious national journalism. So it's a really big disaster. And I think that this is obviously one of the things that's fueling the rise of the far right, because they can feel that lack of authenticity. You know, a lot of these folks come from communities that are total news deserts. They don't have any news that maybe some of them would even be involved in if they had, you know, places to work in these small towns. And it just creates disinformation, disenfranchisement, and regionalism. I mean, yeah, a kind of regionalism that is so closed that you just have no way of reaching outside of where you're from. Because we also, this is, I'll end with here. I think as Canadians, we forget like that Canada is really different everywhere. You know, like you can drop someone into the downtown of any city in this country and it's obvious that you're not where you just were. Like there's a culture, there are accents, there are ways of doing things, there's ways of struggling for things and whatever, thinking about things that are so different all across this country. But with our media so concentrated in Toronto, it creates this common, this identity in our minds that doesn't actually exist. And if you're lucky enough to tour Canada all the time, I mean, I'm so lucky that I get to do that. Those difference, I mean, I also live in Quebec, so like the differences are like, you know, all the time. That's all I see. It's a really big part of the problem with how we talk about ourselves as Canadians. And the fact that there was no national coverage on COVID that was untied from the Ottawa political partisan scene, unbelievable. Like, how did we not know where the hotspot was every week in this country? Unbelievable, right? You just had to, you had to do the research yourself. There was no journal saying, well, today, bad news for in Winnipeg, you just eked out Saskatoon for being the worst city in, like, you know, just give us an idea. And so what's created is this idea that everywhere is the worst all the time. And that creates a tremendous anxiety and no real ability for us to go, okay, things are worse, things are better, things are worse. Just always in this state of panic and anxiety. And you can see that everywhere.
All right, let's bring in Nili into the conversation. And Nili, the structure of the book is chronological. First chapter covering March 2020, the penultimate chapter, March 2021. And I have to be honest, as much as I enjoyed it, I want to lead off with that. Among my multiple responses to that chronology was, thanks for helping me relive all of that, I think. And so, obviously, Nili, lots can happen in a year, but as we've heard too, sadly, lots can also stay frustratingly the same. And so I'm curious for you, what was it? What stood out for you as you got to relive and revisit the events of that year plus documented by Nora?
Yeah, well, for sure, one of the stressful things in reading it, and one of the things that I said, I finished the book and put it down. I said to my husband, I think that's the first time I've read a book where it's talking about a history that we did just live through. And it is, I think it's sort of telling that it ends with, you know, how this turns out, because of course, because there's been another year since this book ends. And so I would go back very much the same as Nora did and say, you know, in March of 2020, I was with my family on our way to Florida for a vacation. Just as the pandemic started, we turned around, we came back. And I picked up the phone, and it's the first time as a family doctor that I had ever done this. I picked up the phone and I phoned CBC in Ottawa. And I said, we need to talk about the structural inequalities in our city, in our province, across our country. We need to talk about healthcare, and we need to look at the forest, not just the trees, and we need to talk about what this is going to mean for all the vulnerable people in our communities, as well as for primary care. So I became involved in part of this spin, this whole thing that Nora is talking about. I became involved as a doctor, saying, yeah, no, what is being said in the media, what is being said by public health, what is being kind of promulgated as this is, you know, the message that we're gonna share with the public, was a very different message from what we were even being told privately as doctors by the same public health units that were giving public statements all the time. So it was driving me crazy. So I decided, that's it. Like, we need to talk about this. We need to talk about the false dichotomy between saving lives and saving jobs, which is actually what was just written in the Globe and Mail yesterday. This idea that we have to choose between economics and health has been so pervasive throughout the pandemic that it has led people to think that there is this choice between one or the other. I got sucked into a CBC interview in October of 2021, in which it's just such a wonderful metaphor, but I was there as the female family doctor being pitted against this male specialist. And I was positioned as the person advocating for paid sick days, for PPE, for testing, for tracing, to say that we needed to take care of the community. The way that CBC did this is, and they didn't tell me ahead of time that the other person, he was going to be this advocate to say that we need to open everything up. So it was this, do we tighten or ease restrictions dichotomy? And I was caught unawares because I didn't know about clickbait. I didn't know. I mean, I did, but I didn't. I had never been used as clickbait. Right. And the misogyny, the ways in which I was then dismissed as the female physician, all of that has continued, but it's also escalated. So over the last 2 years, what we just saw in Ottawa, what we just saw with with the white supremacy, with the women being threatened in the streets. So there's the misogyny, there's the racism, there's the anti-Semitism, all of it. We've been experiencing that as doctors who have been advocating for the community, who've been speaking up for people who have disabilities, speaking up for seniors, speaking up for kids, speaking up for women who are disproportionately affected, for people of color, for Indigenous Canadians. We are attacked like nonstop by trolls on social media, but also, I was very open and honest about the death threat that I received. So, but it all goes back to what Nora is talking about in her book. It is the way that this has been presented to the world. We've given people this pretense that there is a choice you have to make between taking care of everybody or your own selfish, exceptional needs. So all of this idea that instead of talking about, should we open everything up? Should we ease restrictions? Instead, we should talk about, do we want to protect the vulnerable or don't we want to protect the vulnerable? It's a very different conversation. The same thing has happened in terms of all that data about who's been hospitalized or who's died from COVID, that like we have to rely on our own colleagues providing information, but it still also misses the information because it's not just who died. There's this whole debate about did they die from or with COVID. A lot of that has happened in the last year, even like before Nora wrote this, but the idea that there are pre-existing conditions that is so ableist that the people who are, one of the times that I was attacked by, I'm not even going to say that they're journalists, they just write nasty things, but one of the times that I was most horrifically attacked publicly was when I said we need to advocate because children and infants are going to get COVID, and I was told, nope, there is no data to support that, and how dare I say that? Well, we have to look not just at how many children end up in hospital, but how many children bring home COVID to their younger siblings who are too young to be vaccinated? How many parents and grandparents and people with disabilities in those families and other people in the community or educators, my own patients who work as educators, were terrified to go back to work. And now here we are today in Ontario being told that Kieran Moore is going to get rid of the mask mandate in schools. So all of the ideas about do we think of masks as a hardship, or do we think of it as protecting our vulnerable? Do we think of vaccines as its own kind of category of being very, very poorly handled by media? Like, do we think of, like Nora said, the media created this idea that there was vaccine hesitancy when it didn't exist in Canada? Well, boy, oh boy, I spent 2 years talking to the media about the reasons that we need to protect our vulnerable populations. And then they started talking about vaccines and are vaccines safe? And well, what do you say to these people who have these questions? And they did it again and again and again. And I kept saying, please stop. please stop asking that question as though that is what is on Canadian minds, because it's not what's on Canadian minds, only now it is. And of course, social media explodes that. And the vax hunt is another example. There should never have been a vaccine hunt. Vaccine hunters should never have been necessary. The whole idea that
what that is for those who aren't on Twitter.
Vaccine hunters? Well, vaccine hunters was it was a group of volunteers who stepped forward to help people to locate where they could find vaccine doses. But back in February of 2021, I put together a panel and we spoke with the Prime Minister and the Federal Minister of Health to say there are going to be inherent inequities in terms of access to vaccine. All of those people who can't just jump in their car and drive to the nearest pharmacy or hop into their car and go searching for a vaccine or stand in lines for hours. All of those people are going to be disadvantaged by this ridiculous system of the way that vaccines were rolled out. And as a family doctor, I mean, I was also outraged because primary care was excluded almost everywhere in Canada from vaccine rollout. But the idea that we'd have to hunt and that people would care about the brand, I mean, it makes me think of sort of Naomi Klein and
no logo,
kind of no logo, like the whole idea of brands. In 10 years of working, nobody has ever asked me what brand of vaccine I was giving them when I was immunizing their children against measles, mumps, rubella, chickenpox. So all of the narratives about vaccines came from the media, just repeating again and again these stories that were not the stories that we should have been telling. We should have been talking about the fact that in schools, we've always had vaccine mandates. In schools, there are already all of those diseases that we have to, by law, prevent. And as a doctor and as healthcare workers, it's nothing new to have vaccines. We've always had to. I couldn't start medical school without updating my hepatitis B vaccine, ensuring that my meningitis vaccine, that my measles, mumps, rubella vaccine, all of it had to be up to date. So a lot of the ways in which things have been reported creates a false idea about this being novel, or it even being something that we should be debating. And I guess, I mean, the other thing now, when we're talking about, well, our politicians are saying that they're so done with COVID and, we need to return to normal. We're not done. We're not done locally. We're not done nationally. We're not done globally. And all of the disinformation, all of the hate, all of that is kind of at a point where even by saying, no, it's not okay to take masks away from schools, that it's not okay to get rid of vaccine mandates, all of that is making ourselves more vulnerable to then being attacked. So the whole 2 years have been trying to advocate for people who don't necessarily have a voice, and then speaking as a woman physician and saying, don't you dare interrupt me or tell me that I can't speak because I'm a woman or because I'm a family doctor, and trying to help people to understand that I had to advocate in school boards for educators to be allowed to wear masks, because I had to explain to school trustees that COVID is airborne. Like, why do we still have to explain that 2 years into a pandemic? Why do we still have to explain why the masks, the vaccines, all of that is taking care of the whole community? And why do I then have to worry about my own safety, in the context of escalating violence and harassment and threats? So as somebody who is told that I'm a charter violating Nazi slut for advocating for my community, I mean, all that I can say is we're going to see Omicron is not going to be the last variant. It already isn't the last variant. We are going to see that the pandemic will not end because we are irresponsible. And you look at countries like Denmark, where they just got rid of all the mandates, and boom, that COVID rates go up. we're going to do the same thing. And I'm tired of saying it was predictable. I'm tired of saying it's preventable. And my colleagues who work in the healthcare system outside of, like, I'm in the community, my colleagues who work in hospitals are, they are exhausted. They are understaffed. The healthcare system really is at, it's beyond a crisis point. So when we say that it's not safe, it's not just because, for example, COVID is spreading in schools like wildfire. It's also because every time we get sick, or the people who work in the grocery stores get sick, or the people who drive our buses get sick, there's nobody to replace them. And I guess the last thing I'll just say is that the whole nonsense about only staying home for 5 days has meant that people are going back to work and back to school, and they are ensuring that other people around them get sick. And it's just so irresponsible, and it's just a political decision. It's not a health policy decision that makes any sense. So I'll leave it at that. But I mean, there's so much richness in this book, and there needs to be a second volume for the second year of the pandemic. But the ways in which we have experienced this, and I mean, doctors are right there with you, Nora, pulling out our hair, and nurses are pulling out their hair, and some of our colleagues who are brave in public health are also pulling out their hair and speaking honestly. It is disappointing that not everyone in public health feels that they should take this opportunity to be really honest and talk about the ways in which we're letting each other down.
Okay.
I'll leave it at that.
Just before we go back to Nora, I want to encourage people who are watching this, if you do have questions or topics you'd like us to get into here, there is the chat function that will go to Greg, who's moderating things behind the scenes, and then we'll deal with those in about 20 minutes or so. I sense that both Nili and Nora will be happy to proceed with or without questions from the audience. So, Nora, I just, I wanted to talk about, I used to do some communications work for an organization that was, as they put it, public health facing. And so I'm embarrassed to say, despite having done journalism for about 3 decades, I was really not overly familiar with public health and what, in theory, an amazing lens on the world it is. For example, looking at social determinants of health, how things like income, that the economy is a determinant of health, how much money you make, poverty is a determinant of health. But I often felt there was this real tension between what public health maybe, and this is an inference on my part, there was a tension between what I think, if allowed to say what they really wanted to say, senior public health people would have said something much different had they not had to take into account what politicians, the ultimate decision makers, were laying out in terms of room to move, room to maneuver. I don't know. Is that public health was supposed to be at arm's length. If I'm not mistaken, there was a real push towards it the first time SARS came along in the early 2000s, and they felt we need, kind of like the budgetary officer, right? On the federal level, we need somebody who's not politicized to give us the straight goods. It hasn't quite worked out that way, has it?
No, and I think it goes back to a question of crisis management. Like, the tone was set in March 2020, and the crisis management strategy taken by every government and every chief medical officer of health was overload with data, reassure, repeat those measures that they wanted us to follow for good reason, and that's it. And then let the political decisions happen, right? The political decisions to give this money here, or to close this thing down here, or make this essential list there, or whatever. And, what's so interesting is that public health in this country is so different from region to region. It's set up so differently. You have the whole province of Alberta versus like the tiniest public health unit in southwestern Ontario doing its own thing versus, Quebec and actually having its own statistics agency. Like Quebec has been, Quebec has been the leader of everything from deaths to the best data, the most, from what it seems like, the most like driven by public health kind of responses. To an extent, I'm comparing it to like a Scott Moe, right? Or my God, Pallister or whatever, whoever it is now, right? I know that there's still two fighting ladies. No, I know there's not.
No, Heather Stephenson.
Heather Stephenson. Who
famously said it's up to Manitobans to help themselves.
Well, and Pallister famously said, like, this is your World War I. Like, we're going to war, right? And it's like, what the hell does that mean? Like, no, we had a pandemic and a world war at the same time. Those were two different things, my guy. No, so the failure or the incapacity of public health to be able to push against political lines, it's obviously a failure of design to a certain extent, but it also assumes that any of this could be done without politics. And I don't think that's possible. I think that at the end of the day, every one of these bodies is a political body, and it was political to make Bonnie Henry into a hero. It was political to it was political to keep Williams. I always want to say Mick Williams, but it's Williams, right? The former chief medical officer of health in Ontario. I was political to keep him around way past his expiration date. Like, that was done on purpose, very obviously. And by the end, it was like not even clear if this Ontario Science Table agreed with what he was saying or not, right? That actually came out in the press. But there's no coordination. And this is, I think, the biggest issue. So I look at this as someone who like doesn't think Canada should exist and thinks that Canada needs to be fully undone and replaced with something that we all collectively need to come up with. I look at this pandemic through the lens of federalism and say, what did federalism give us in this moment? Like, the whole reason we have a federation is to equalize inequalities, to have economies of scale, to use our collective power as a nation to help one and all this stuff. Federalism did nothing in this pandemic. It did absolutely nothing, because all it did was, it was the argument for why one level of government couldn't act and why one level of government couldn't act. And this is provincial and this is federal and blah, 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 and blah, 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 and all this fighting all the time. And you're like, this is useless. And so when public health is expected to also operate within this logic, it's impossible, because they are agents of the municipality or the municipal structure or the provincial structure, right? Like, the federal government didn't even force uniform data collection from province to province. Like, the most basic things that the federal government could have done to bring coherence and cohesion to this response, it did not do. And it didn't do it because it was the easier way out to just say, federalism, we can't do it. We got to call in the army. Oh, the army. Yeah, the army can do it. Sure, we'll call in the army, right? Wait. I think you couldn't do it. No, but we can do the army. What the hell are you talking? And I think that this past week has shown that all of that was crap. All of that was completely fake. That if they had invoked the Emergencies Act to come up with some level of coordination, to use a medical-based national emergency to not take away civil liberties, but instead create field hospitals, create COVID clinics, do something. No, that was impossible. That was absolutely impossible. And then all of a sudden it was like, oh no, of course we can do the Emergencies Act and emergency. We have an emergency in Ottawa right now. And so I think, we're going to be untangling this moment for a long time, because it is like, I see this as being like the federal government and the provincial governments, all this to do this too, turning on a tap of what works. Turn on the tap, turn off the tap. And they've turned on the tap on trying to give people a little bit more room, turn off the tap, we've got to lock down. And it's as Nili said, it's rarely scientifically driven, even though it's, Justin Trudeau's favorite thing to say. It's very political, and it helped very much that this is a provincial matter and not a federal matter. And lives were lost as a result of that.
I've actually discussed with my friends about, health is a provincial responsibility. And then if you subdivide public health into these units, in some cases, if I'm not mistaken, one of the things that gave rise to I Don't Know More was a federal decision about waterways that cut across different provinces.
Mm-hmm.
And, you know, I keep coming back to kind of like water as an analogy for how diseases move, and it follows the path of least resistance.
Yeah, totally.
And, you know, having, you know, disproportionately racialized, genderized, ableized rates of poverty, for example, are paths of least resistance. And so given that the pandemic has no interest in, or, you know, doesn't obey jurisdiction, couldn't, as you hint there, the feds have declared an emergency and said the pandemic, we're just responding to the phenomenon of a virus and the way it works.
Well, here's a ridiculous example. Okay, over the holidays, I went home to where I grew up, which is in Southern Ontario, a town called Georgetown. It sucks. Don't go there. If you're tuning in from Georgetown, I'm sorry, but you know that I'm right. And it was at a time where Quebec had not had the third doses on the radar at all. We knew that it'd be weeks and weeks before we can have third doses. I wasn't going to go and get a third dose if other people needed it in Georgetown in the Halton region, but I was curious, right? I'm like, could I get my third dose while I go home? And you can't get it if you don't live in Ontario. I live in Quebec. I'm like, that's very weird, because when I was getting my second dose, everyone in the room were tourists because I was getting it in old Quebec City. And everyone was speaking English. And I said to the nurse, I was like, this is weird. Everyone's speaking English. She's like, no, it's not weird. We're vaccinating everyone who walks in the door, tourist or not. I was like, of course, that's not weird. That makes sense. So here I am home. And I was like, okay, well, at least my brother can get his vaccine. He lives 2 health units over, 20 minutes away in Etobicoke. He couldn't get a vaccine in Halton region either, because it's just for the residents of Halton region. So it makes absolutely no sense, especially in a place like the GTA, where workers would cross 5 or 6 public health units to go from work to home. And you see that in their data. You know, York Region Public Health is one of the few that reports deaths related to workplaces, and they have to segregate it. Deaths from residents of York Region working outside, and deaths of other people working in York Region. And it's like, I mean, I like the granularness of that data, but like, what the hell is the point of that? You know, it's all very like borders in this whole story are the most ridiculous thing. Everything from how we protected the border and global transmission rates and how we all move across borders, but they are especially ridiculous when we're in such close quarters with one another, and things were so different. And then look, like, I mean, New Brunswick and Quebec had police checkpoints up for how long? 6 months? Like, it was ridiculous. There was Mi'kmaq students that could not go to school because their school was on the other side of that checkpoint. That's right.
So I was just going to jump in there and just say that early on with vaccine rollout, and this is just Ontario specific, but what was happening in Ottawa is that we were being told even public health wasn't allowed to participate in vaccine rollout. It was given to hospitals, and hospitals weren't supposed to let public health be involved. The public health was then having conversations with us as physicians in the community and saying there's nothing they can do until they get access to the vaccine. Then one thing that was maybe telling, and I don't know if I'm allowed to tell this to the rest of the world, but they would say, well, Dr. Kaplan-Myrth, you can be critical. We can't be critical, but you go right ahead and be critical. I think there is a fear that public health units will lose their funding, that public health units will be shut down. I still to this day don't understand why my colleagues who work in British Columbia, who are family doctors, still can't give vaccine where, I basically said, okay, challenge accepted. And that's why we did Jabapalooza and gave, 14,500 doses, because we said, well, we can do this in the community, because all that I have to do as a family doctor is say, okay, volunteers, let's do it. And then boom, we had all of these people. And that's what we said should have happened across the country and could have happened across the country. I, as a family doctor, also couldn't get the vaccine myself, because when it was available to healthcare workers, it was only available to healthcare workers who worked in hospitals. I had to drive 300 kilometers to get myself a vaccine from another family doctor, and so on and so forth. So it's all just absurd. But if you step back and you look at just going back to all these sort of false dichotomies that have been created and sustained throughout the pandemic. If you look at comparing Canada to the United States, if in fact we hadn't helped to protect the vulnerable, we would have been like them, where for even adjusting for population, we had a third of the deaths, the excess deaths from COVID in Canada versus in the United States. Why did we have only a third of those deaths? Because we protected the vulnerable. So now every time anybody reads in the newspaper or watches the news or hears people talking about, is COVID over? Can we return to normal? Should we get rid of masks and vaccines? You need to think about it as, are we finished protecting the vulnerable? Are we finished protecting children, babies, seniors, people with disabilities, our Indigenous populations, people of color? Are we finished with protecting them? Do we not care anymore? And is it really only about the individual? Or is it about acknowledging all of these systemic issues and taking care of each other? The whole phrase, we're in this together, that people were using at the beginning of the pandemic just kind of lost its meaning, because then everyone was the exception. Oh, we're in this together, but I'm going to go to the gym. We're in this together, but I don't feel like wearing a mask or whatever. So that idea, like we are actually in this together, and globally we're in this together, that is where we need to say, that is where the provincial and territorial differences don't make any sense. Obviously, getting together and speaking to the Prime Minister didn't make any difference in terms of how vaccines were rolled out. I'm pretty tired of people telling me I'm uneducated and I should go back to civics and understand that health is a provincial issue and not a federal issue. Because what we're talking about is that all of these issues, they affect all Canadians across borders, across geographic differences, rural and urban, across political differences, and we should be able to have respectful conversations across those differences and take care of each other across those differences. So the question is what is going to happen next, and if we don't address these issues, then we're going to see more people who are going to be suffering from long COVID. We're going to see more people who are impacted in every way, and our healthcare system just can't take it.
Well, Mike, we do have questions we're going to get to in about 5 minutes, but I just wanted to sneak in this one aspect, if I could, with the both of you, and it does in a way touch on what happens next. I want to share some names with you. When asked about who owned the patent to the polio vaccine, Jonas Salk famously replied in 1952, "The people, I would say. There is no patent." He added laughingly, "Could you patent the sun?" Similar story with insulin, discovered by Frederick Banting in 1923, and according to Vox, he refused to put his name on the patent. He felt it was unethical for a doctor to profit from a discovery that would save lives. His co-inventors, James Collip and Charles Best, sold the insulin patent to the University of Toronto for a whopping $1. Inflation has probably destroyed that. That's 1923. We're basically a century later. What are we to make of how pharmaceutical companies and governments are behaving now regarding patents on COVID vaccines?
Yeah. Okay. So this is where I wish that everybody watching right now were like the far right convoy people, because it's like, you're right, big pharma is bad. Okay, right?
Yeah.
It's like correct, like no question. And what's happening right now with doctors in South Africa having figured out Moderna vaccine, and now they're having Moderna attack them and try to get them to stop production. It's disgusting, right? It's absolutely disgusting. It's repulsive. And the problem, though, is it all still operates in a logic that we are all swimming in. That this logic is like everything has to be done to protect the status quo. And the status quo does mean massive profits for pharmaceutical companies. Was the pandemic created so that they could have massive profits? They don't need this. They have massive profits. You want to make a lot of money? You start a war. Everybody knows that. And big pharma, they can get in on the war too. I mean, like that's my favorite thing, where it's just like, guys, like simplest answer is the best. Okay. Like, have you ever seen government plan anything? They're not planning a global pandemic. It's not possible. but this is the logic in which we live. And so, you know, here we are, a nation that has been very, very bad in terms of how it has operated with other nations around our responsibility to get vaccines to the world, to instantly support the TRIPS waiver, to make sure that those vaccines couldn't be patented. You know, mRNA technology is like the biggest medical advance of like, what, a generation? Like it's huge. And either we enter this dystopian world where it's owned by these companies and sold and withheld, or it's for the public and it's in the public interest. And of course, all of this stuff is funded by the public interest. This is the thing that's so enraging. You know, my partner's a professor, and so I see how the universities really put the screws to professors to patent and to profit and all this bullshit. And it's like, we paid for this, right? The Americans paid for Moderna. The Germans paid for BioNTech. And actually in Germany, like they say, don't call it Pfizer. It's Pfizer BioNTech, because the national German, whatever the hell that is, not a private company, paid for the development of it, right? And so it's an example of where we are as a society. And it's like, anytime someone says the markets can save us from the healthcare disaster, the markets can save us from food insecurity and all this kind of stuff, it's like, they will never save us. They don't give a rat's ass about us. And worse than that, we just saw how easy it was for governments to just literally sacrifice people, because the mass deaths that happened in long-term care, you know, by any measure, right? Excess deaths are an obvious measure. Those people didn't have to die, statistically speaking. Outside of excess deaths, the people that died in these horrific deaths away from their family members, by themselves, with care workers who were like at the end of their capacity, like this was by design. And, you know, the fact that like no one's gone in trouble for it, there's not really a movement for opening patents. I mean, patents are still at the core of why we're going to war with China, right? Like this is like, the Chinese don't respect patents. I'm like, don't make me support China. Like that sounds awesome, right? Patents suck, okay? They suck. So yes, and then here's a completely different point. Where is that message in the mainstream media? No, like there is no left-wing criticism allowed. You know, Nili, when you're talking about the interviews that you've done, yeah. I've done 17 interviews, period, total, this whole pandemic on COVID. 17. Like, well, and you know, and if someone else was doing them, I'd be great, you know, but it's no one else.
The problem is that the soundbite that they'll take is going to skew what you were saying, right? Oh, yeah. So you can have a whole long conversation with, I know actually this happened to a colleague of mine where she had a whole conversation about the risk of COVID to kids, and they only took one little bit of her sentence in which she said, but right now, most people, you know, who are in hospital don't have COVID in the pediatric hospital. Like that manipulation of what we say is always the danger. Mm-hmm. In terms of pharmaceuticals, I mean, of course, big pharma is a problem. And also, we're trying to keep people out of body bags. So when the pandemic started, I was worried about rewriting my will because I could die taking care of patients. And that was the reality. Like that's what we were seeing in New York, in Italy, in China. We were seeing healthcare workers dropping dead and people dropping dead by the truckload. So the vaccine means that here we are, we're still alive, and I can safely see patients in person and all of the rest of it. Also, when I say that, you know, we need to make sure that we reach teens, that they get their third doses, that all the kids get their 2 doses. You know, people come back and they say, oh, well, don't you think that before you start giving teens their 3rd dose, we should really worry about people in Africa? It's not a either or, it's an and. Of course we should. Of course we should ensure that there's access. I mean, there's a whole lot more than just an issue of access when it comes to most of the world's population and legitimate fear of what we're bringing, right? So Dr. Paul Farmer, who just died, he you know, he could have a very trusted relationship with people he was working with in Africa, in anywhere in the world, though, where there's a history of colonialism and all kinds of medical abuses. It's much more complex than just whether or not we have vaccine. I can't go and bring my team of volunteers with Doctors Without Borders and just show up in some country. And I mean, as an anthropologist, I know that, but everybody should know that anyway. Like you just can't do that. You can't just say, oh, well, here we are, you know, everybody line up and we're going to give you this vaccine. Not given human history in the way that we have abused our medical kind of colonialism. So so much more complex than just whether or not we have patents or no patents. But vaccines save lives, and that part of it is true. It's why my colleague David Fisman says that air is the new poop, because we got rid of diphtheria because we convinced people that we needed to have separate water supply from what is filled with sewage, right? And it's not a long history. It's like, how quickly do we forget? My patients who are in their 80s, one patient said to me, like, her sister had polio and had severe disabilities throughout her life because of polio. Well, they were going up and down the blocks in Ottawa when she was growing up, and they had gotten to her block 1 week too late, and her sister got polio. And all the people, when I was going into retirement homes and who were like 100 years old, they're like, absolutely, I'll take a vaccine, because we've seen what happens when we don't have vaccines. So we just lost that. That maybe goes right back to where you started talking about erasure of history, but like we lost that because we don't see it, because we don't see that our children could be deaf, or could end up with meningitis, or could end up with any number of serious complications if we don't give them the vaccine preventable, if we don't prevent the vaccine preventable illnesses. So it's just, it's the privilege of living in a world in which we think that it's fine to be unvaccinated is a very recent historical thing, and it's a very isolated privilege. So
okay, we have about 25 minutes left and a number of questions. So at the risk of pushing you guys into soundbite territory,
I'm comfortable there actually, so let's do this. It'll be a challenge.
So I'm going to break it into 4-minute chunks, and then I'll give you like a 30-second quote unquote warning. But anyway, it'll feel like maybe I'll do like the Oscars. I'll play music or something. All right. So this question is for both of you from Dietra. I'd like to hear about testing, particularly rapid testing here in Newfoundland, and Labrador. All protective policies are evaporating by March 14th. We've been told to manage risk on our own, and yet we still don't have access to free rapid tests outside of the school system. Go.
Yeah. So when Nili mentioned what's going on in Denmark, they got rid of all these restrictions and COVID cases spiked. We only know that because they have widespread PCR testing, right? I have a friend that calls me at random times of the day from Berlin, and he once called me going through one of the rapid testing sites that has been set up in his neighborhood in Berlin, and he says you cannot walk more than a block without bumping into a rapid testing site, and you need that before you actually go into the bar. And that's how they're trying to manage this in Germany. So you'll have to be double vaxxed, and you have to have a negative rapid test, a rapid antigen test. This is for me the biggest issue right now, because yes, we can talk about what is more safe to do right now. Like, I'm a soccer player. I've gone back and played soccer. I'm like, oh my God, I don't want to get COVID, but here we are, and we're all double vaxxed or triple vaxxed or whatever. But it's the testing that gives us the idea of what's going on. And the fact that we undid PCR testing, we got rid of PCR testing for the vast majority of Canadians and did not give them rapid tests is like just an incredible scandal. I was looking at the bar graph. So I live in a province where we actually can get this data. It's amazing. Looking at the bar graph of my city of outbreaks, right? And the outbreak data is like, workplace, right? Tiny bar of healthcare workers, because it was managed better than in workplaces. Not tiny, but smaller. And then all of a sudden, boom, a huge bar of healthcare workers. And it's like, right, because they're the only ones getting tested. And so if it was a tiny bar for the whole pandemic, and then all of a sudden the bar turns like this for how many healthcare workers were having COVID, then you can imagine how many people were having COVID by proxy, right? We have no idea. We're expected to manage this pandemic, and we're expected to open up with no idea of how much COVID is circulating. It is a disaster. And rather than having early warning signs to say, warning, there's a lot of COVID, we're going to find out the hard way as people show up at the emergency room, and there will not be the capacity to help them.
Well, unfortunately, we won't find out all the people who don't show up at the emergency room. Right. And in Ottawa, until April of 2021, family doctors could report to public health suspected cases as we were speaking to our patients. They shut that down in April. I don't know why that was shut down, but we don't have any way. So we don't have any data. We don't have any way to know how much COVID there is out there. I know, speaking to my patients, who has COVID, and they know who in their children's daycares have COVID, but there is no reporting. So, but this is all very convenient way to say, oh, see, our numbers are good. Well, we were still reporting an R of higher than 1 very recently, even with such limited testing. And now, I mean, there's no data. So that does not mean COVID's not out there. It absolutely is. And people can be reinfected. So I guess to answer the person in Newfoundland's question, what can you do if you don't have access to rapid tests? You need to proceed as though everyone around you very well could have COVID. You need to make sure you have your vaccines. You need to keep your masks on, and you need to stay very cautious and distanced from people who aren't necessary to interact with, because if you just go out to a restaurant or you just go out to whatever, you're going to come into contact with somebody who has COVID, and you don't know you don't know whether or not you have COVID based on whether or not you're symptomatic at that point, or whether you're contagious, because you could be contagious but not symptomatic.
And I seem to recall there was talk of like the federal government using Canada Post and just sending tests out to everybody. Again, maybe under the Emergencies Act. You don't even need that, probably.
No, they have a postal service, right? Like, that's the best thing about Canada Post. They could do that.
Yeah. Okay. So that's 4 minutes. Let's move on to the next one. We'll let Nili lead off. Before I do, a reminder that signed copies of Spin Doctors are available through Octopus Books. So go to the website and you can find that out. All right, from Faizan, what suggestions do you have for health professionals and society at large to ensure that mental health is supported and enhanced, as many have struggled with depression and anxiety over these past 2 years?
So actually, that was something that I meant to mention before, is that back in September of this year, when we were lining up in front of Queen's Park to talk about safety in schools, one of the arguments that was used for schools to be opened was kids and mental health. But if you speak to any teachers and you speak to any doctors, you'll know that we don't provide mental health services for kids in the best of times. And so, if we are actually serious about mental health, if we're actually serious about being concerned about youth mental health or adult mental health, we need to put something into publicly funded mental health care. It is a huge crisis that predates the pandemic, and that has been exacerbated. For doctors, there's a lot of, and healthcare workers, there's a lot of lip service to self-care. It really doesn't help to be told to be mindful when you're working 60 hours a week and you're dealing with a system in crisis. But there is a real need in Canada, across Canada, for publicly funded mental health care, and not just a day devoted to a big telecom company, but an actual real commitment to publicly funded mental health care. And if we're serious about mental health and kids in school, we should also look at the real data around that, because actually for a large number of kids, being out of school improved their mental health. So we need to look at also what are the stressors in our lives. For many of my patients, switching to working from home was a huge relief, because a lot of their stress was in the workplace. But of course, again, women were disproportionately then saddled with the double burden of also taking care of children while children weren't in school. So there are all of these things, but mental health is something that we do not treat the same way as we would treat you if you had a broken bone or if you have appendicitis. We will fully fund your surgery. We will fully fund your care for anything physical like that, although we don't fund eye care or dental care. But and doctors aren't without blame for all of this, because there are a lot of physicians who advocated very strongly for privatizing all kinds of aspects of healthcare. But it's just such a discrepancy. My patients who can afford $200 an hour to see a psychologist or another psychotherapist because they have benefits or financial means shouldn't be the only ones who can get trauma-informed care.
Yeah. The only thing I'll add to this is I think there's a mental health crisis in society that doesn't come from nowhere. And certainly the pandemic has made it worse, but we all know that this has been something that has been very much part of everybody's lives for many years. And so I think we also then have to look at the structural issues, right? Like there's a reason why universities would bring in puppies to help people with their mental health rather than consider having free education, right? It's because free puppies are a lot cheaper than having free education, but one will do a lot more to improve people's mental health than the other, right? Unless you get to keep the puppies, which they never did, right? So I think that looking at where our society is right now and what has happened under austerity, these have direct impacts on people's mental health, and also wealth and inequality. You know, we've got a household debt burden that's 170% of household income. How can anybody be mentally well with that being their reality, right? When every dollar you're making is to try and pay down this $1.70 of debt that you hold. It's unbelievable. And so when we're talking about mental health, I mean, it alone is important. And so that's Nili's answer is great. But then when we have that conversation, then we also have to step back and say, why are we having speculation within the housing market? Like that's ridiculous. That's going to drive people absolutely into very poor mental health, access to healthcare, access to education that is free, access to other social services, and then other things like more time off. Like I know paid sick days is a big deal, but after this pandemic, I know I finally am saying it. After this pandemic, why has there not been a week of holiday, national holiday? Everybody needs to just relax. That's not radical? Like other countries do that stuff for kings sometimes. Like let's just call that, right? So we have a very sick culture right now, and of course it's appearing there.
All right. Well, we went this far without profanity. Awesome. But anyone who's a regular listener to Nora's podcast, it will not be clutching any type of pearl.
If you are clutching your pearls, I won't swear again. How that? Okay.
Well, I've been holding on to this line about how, COVID in a lot of ways is the perfect shitstorm, but I won't because that's probably rude too. Okay. We have a question about social solidarity, how to build it, and we have a question about improving the construction of narratives that are up to the task in mainstream media. So it's 7:16. I think we can cover both. So why don't we start with the question about mainstream media? We'll start with Nora. This is from Alana. As writers and journalists, what are things we can immediately begin to do in mainstream media that can shift the narrative? I'm thankful for alt/left media, but they're alternative/left. I didn't mean to say alt-left. But there are obviously barriers for left-wing people and socialists to get access to mainstream platforms.
Yes. Okay. So if burning things down is not an option, and I'm not going to suggest that because, it gets complicated when you start to talk about structure fires. I think that we have to be very clear about what the causes of the crisis in mainstream media is. And I'm someone that I consume mainstream media, right? I depend on the CBC. That's why I scream at it all the time. We need a strong mainstream media system, and we are not going to get it from capitalism. I think that is very, very clear. One of the things that I've just been so scandalized by is, the CBC was used as a public health education tool from the start of this pandemic. They had ads. They were telling us what to do. They were telling us everything that we were knowing. They're carrying live, basically PR exercises every single day for the premier of every province and for the prime minister. And they got $0 to do their job. They got nothing. Rogers got $120 million in the wage subsidy, and so did Bell. And all of the other big telecoms were able to get the wage subsidy, and nothing went to the CBC. Not that throwing money at the CBC is going to fix all their problems. I mean, you also have to fire all the managers there. That's a little bit more complicated, but that is one of the things that, it's unbelievable. The time that we needed national public broadcasting that could hit every part of the country, except on those stretches of highway where there's no Tim Hortons. We needed the public broadcaster to be there for us. And what was the first thing that they had to do, or management decided to do? They cut local news broadcasts. They centralized all local news broadcasts in Toronto, right? And so I'm someone in Quebec City. My God, help us in Quebec City. There's no English media. I would hear English media first thing in the morning. I would hear Toronto. I would then hear Montreal. I would then hear Toronto. I'd hear Quebec City, but for the whole province again, and then a bunch of Toronto. It's just it's completely unacceptable. So that would be one thing, is absolutely pouring money into the public broadcaster. But if you are a journalist working in this world, push the boundaries, especially if you're unionized and you have a proper job, push the boundaries. If you're saying that 10 people died at the Loving Gemstone Care Home and whatever, say who owns it, right? Who owns it? That's an extra 5 minutes of research. It doesn't take any time. In Ottawa, every single media outlet in Ottawa, CDC Global, CTV, the broadcast ones, never, ever state where someone has died. And I, every single night, go all of these things. It's like, oh God, Ottawa Public Health. Oh, it's right there. Why would that be the case? And these are agencies who in other parts of the country are always naming these facilities. So there's some very minor things that can be done too. And you'll have to read the book for the whole list of them.
Good plug. Okay, Nili? Maybe I can answer the part of the question about social cohesion and what can we do, because
okay. Well, let me bring the question forward. Then that's by David. He says, how are we going to build social solidarity if and when the next variant hits? It feels like our frayed social fabric will not be able to hold much longer.
So, okay. So, I mean, I don't know, people know what Jabapalooza is, but back in the spring of 2021, we started immunizing people who are essential workers. These were not my patients. It was basically like, as a family doctor, I'd already immunized all of my own patients. And then there were all these bus drivers, construction workers, long haul truck drivers, grocers, childcare providers, all of these people who were saying like they couldn't access vaccine. And I said, okay, well, I'm going to help you. And the thing that really kept us going is that every time we did this, we had we used a soccer field throughout the spring and the summer, and then we used also the street in front of my office, and the city councilors came and they closed off the street, and our MPP came and volunteered at like all the Jabapaloozas. He's NDP, Joel Harden, he's great. But the Liberal MPP from Ottawa South also came by, just rode his bicycle over to say hello and to offer support, and the head of the Ontario College of Family Physicians came by, and the president of the Canadian Medical Association came by. All of this was because people were there helping each other. And it was such a good feeling. And community activism and advocacy is really where it's at. I mean, honestly, I'm nobody. I got the Prime Minister to speak to me in a panel of people across Canada because I just reached out and I said, we've got a panel of people who need to speak to you. So I would encourage people wherever they are in Canada to look to community, because community, most people do want to help each other. Most people do want to do the right thing. And when we started doing these Jabapalooza events, it was like the first time that people who weren't healthcare workers, could participate in helping, and they desperately wanted to. So, if the model of helping each other, and honestly, there are so many wonderful examples as well from Ottawa having just been occupied. Volunteers sprung into action, and they started all kinds of ways to help walk people's dogs, get people groceries, just accompany them for their safety around downtown Ottawa. We know how to take care of each other. Maybe public health saying they couldn't be critical of the Ontario government, but I could. Maybe that was in a way a blessing in disguise, because I really did take it as a personal challenge to say, okay, well, we can do this, and we're going to show you that we can do it. But you have to be willing to have nights of anxiety, worrying that you're going to let down thousands of people, and you have to be willing to reach out to total strangers. All of these people, I didn't know them before, and now we get together. Every time we need to immunize another group of people, we get together, and everybody wants to help. So when people donate masks to us, I can say to the city councilors, hey, we've got 1,000 more masks. Let's get these to schools for kids whose families can't afford masks. And people from education step up, and people from the community step up, and we do it. It can happen. So I think we need to hold on to that sense of our humanity, and we need to elect governments that care about that. But we also need to really know that we are empowered. We have that ability. We just have to have the drive to do it. And I'm not a superhero. I reiterate that all the time. I'm not evil, and also I'm not a superhero. I'm just like a normal human being who just, it's like we can each do whatever we have the energy for it. It has to fill you up. It can't drain you. So if people are burned out, if people are feeling like they can't give any more, then that's okay. Then you step back. This is a marathon that does not have an end in sight. So we have to keep helping each other.
We have about 6 minutes left, and I'd like to give time to closing thoughts, or thoughts you didn't get to and you've been dying to express. So, we've gathered here today because of Nora's book, and so I feel like the protocol is to give you the last word, but we don't, to heck with protocol if we wish.
We can just never end, and no one will have the last word.
That's right. Let's just keep doing it. But I wanted to allow for space there. So, so we have, with the 5 minutes we have left scheduled here. Nili, did you want to do final thoughts, and then we'll like I say, let Nora have the.
I think I've sort of already said what I need to say. I think the question, we know how this turns out. We don't exactly know how this turns out, and we're still living it. Yep. So, we have to be critical. We have to be critical thinkers, and we have to push back when we know that something just isn't good enough.
And I know you're editing a book, or maybe it's already done.
My friend Ariel Troster and I, we had a podcast, a prescription advocacy, where we were speaking to women leaders across Canada. We stopped doing that when I started having to give vaccines, but I have been collecting stories for a book called Breaking Canadians, and it's a collaborative book, but it's people telling their stories, because there are so many stories of how people have gotten through the pandemic. As healthcare providers and as people, essential caregivers, as patients, as teachers, anybody. So I'm still accepting submissions, but I am planning to use my March break to put together the manuscript.
Okay.
So.
Wow.
Well, please make sure you don't connect it to any broader social forces. Just hone in on no, just kidding. All right. So just a reminder that if you came in late, this will be posted tomorrow on the Octopus Books YouTube channel. Okay, Nora, take us home.
Oh God, how do I sum this all up? First of all, I'm so thrilled to be able to talk about this. Like, to write this book, I had to pitch the idea in August 2020, And by August 2020, every single night I was reading between 30 and 50 articles to try and find who has died, because that data was not being collected. In fact, I met with Statistics Canada and the Public Health Agency of Canada to talk about my methods. And they're like, oh, we do the same thing. And it's like, oh my God, don't tell me that. I don't want to hear that, because oh God, right? And so from October 2020 to March 2021, I wrote 75% of this book. And then from June to July, I wrote the final 25%. And to do something like this during the pandemic, I hope people feel when they read it that they're plunged back into those moments, that there is this active forgetting happening, to remind us how we felt in those first days of March 2020, how horrible it felt to not know what was going to happen, to have all of our plans canceled, to think of how far we've come, right? How many people have had new relationships or children out of this thing, right? There's been a lot of really powerful and beautiful parts of the pandemic, because humanity is powerful and beautiful. I mean, that's just, we can't get that part of ourselves out of our bodies as much as we try, right? We still are beautiful beings. But this pandemic has tested us all, and it has demonstrated that the government doesn't care if we die. The government does not care if disabled people die. It does not care if poor people die. It does not care if racialized people die. And so knowing that, we have a responsibility to fight every power that doesn't care and that exacerbates social conditions to make sure people's deaths are accelerated. We have to fight that with all we have. And so, you know, I think probably the biggest question, and I get this is probably the question I get all the time. I mean, other than maybe some other bizarre questions that I do get a lot, are like, how do we do that? How do we do that? Nili's talking about creating community around something. You can create community around anything, and people have to do that. Whether it's a community barbecue or your church group doing something or whatever, you have to create that, because you don't know what's going to come after. You don't know how you're going to have to mobilize that to maybe fight power or fight for something that you need. And I think that we have to stop being disappointed when the state fails, because the state will fail us. There's people on our territory that will tell us, stop being we know the state fails all the time. And for especially white people, we've just witnessed that in a very direct way. The state will always fail us. And it doesn't mean that we shouldn't keep fighting for better and demanding more from our politicians. But it does mean that we have to take back the power and do things ourselves when we see that it's not being done by our politicians. And the good news is, when you are engaged in that, when you're engaged in helping people, even if you're tired and you're burnt out and you have that is medicine. That will help you, that will give you relationships, that will give you personal contacts, that will give you an expression of all of the things that you've been keeping up inside of your chest for the last 2 years. And so I hope every person on this call has something, whether it's a neighborhood group or a club or whatever, it doesn't matter what it is. Get together in real life with people in a safe way and start figuring out how you can be as effective as possible to make the change that we need.